Bilal Ahmed.
Hello. Good morning, everyone. First, I would like to thank APO and AIOS organizing committee for giving me the opportunity to present my research work. That is, does mitochondria mediated ferroptosis have a role in primary and chemo-reduced retinoblastoma? As we have already know that retinoblastoma is the most common occurring intraocular tumor of childhood and infancy. Tumor originogenesis is initiated by mutation in RB1 gene that is present in 13q chromosome. RB incident rate is more in the underdeveloped parts of the world like Africa and India with poor prognosis. Systematic chemotherapy and IAC are usually given to the treatment of RB patients. Histopathological factors that are associated with the retinoblastoma. In primary retinoblastoma, as you can see, the PDRB, massive choroidal infiltration, iris and CB infiltration, and Polony was there. And in chemo-reduced retinoblastoma, along these features, foamy macrophages, retinal gliosis, fibrosis, and cholesterol clefts are present. So there are different pathways of cell death, as we all know, but my focus on ferroptosis pathway, where the iron accumulation, lipid peroxidation, and membrane disruption takes place. And this diagram shows the different pathways that are associated with the ferroptotic pathway. So ferroptosis is a novel type of cell death mechanism where iron accumulation, lipid peroxidation leads to the disruption of mitochondrial membrane. Expression of mitochondrial genes such as mitopherin 1, 2, BAX, CSD1, LONP1, ACSF2, and SOD2 might be involved in the induction or suppression of ferroptosis as reported in some studies. And glutathione peroxidase are a group of enzymes that are responsible for detoxifying reactive oxygen species in cell, whereas GPX4 acts exclusively in detoxifying the lipid peroxide and stabilizing the cell, thus it inhibits the ferroptosis pathway. Preliminary study shows that morphologically ferroptosis is associated with the mitochondrial disruption. In our previous study, we have seen during the TEM analysis of retinoblastoma tissues that the mitochondrial structure is disrupted, like degenerated cristae, unswollen mitochondria was observed. So this indicates that ferroptosis might play an important role in the tumor originogenesis of RB. So rationale of the study is that GPX4 acts as a central mediator of ferroptosis and it negatively correlates with the prognosis in several tumor types. Alteration of GPX4 will result in the ROS increase in the cell that will lead to the ferroptosis, as it was seen in renal cell carcinoma. An expression of mitochondrial gene, as I have already discussed, might be involved in the either inducing or suppressing the ferroptotic pathway as according to the other studies. Till date, there are no studies in literature on the mechanism of ferroptosis and mitochondrial mediated pathway in retinoblastoma tumor. This provides us the opportunity to develop prognostic biomarkers and targeted therapy with the use of ferroptotic inducers and chemotherapeutic agents in the survival of retinoblastoma patients. So these are the studies that are done on the mitochondria and apoptosis in RB, and these are the literature that are available on GPX4 role in ferroptosis. The aim of this study was to investigate the gene expression pattern of mitochondrial and antiferroptotic gene GPX4 in primary and chemo-reduced RB tissue samples. So our methodology includes we have included 71 tumor samples where 51 belong to primary RB group and chemo-reduced belong to 21 cases. We isolated the RNA, then cDNA, and we done the qRT-PCR on those genes. These are the clinical pathological details of primary and chemo-reduced RB. As you can see, the male preponderance was present in both the groups. And these are the reaction conditions for qRT-PCR, where the fold change value is calculated by 2 minus delta CT method, and 1.5 above fold change is taken as upregulation. These are the expression levels of mitochondrial genes. And this slide shows the expression level of GPX4 in both primary and chemo-reduced group. In GPX4 expression was higher in the primary group by 52%, and chemo-reduced it was down-regulated by 71%. These are the graphs with respect to normal retina. So to conclude in our study, mRNA expression reveals that LONP1 and BAX was subregulated in primary RB cases like 78% and 86% respectively. In chemo-reduced RB cases, similar pattern of mRNA expression of mitochondrial gene was observed, except ACSF2 that was increased in 53% of cases. Antiferroptotic genes GPX4 was upregulated in primary cases, whereas downregulated in 78% of the chemo-reduced RB group. This result indicates that GPX4 expression in RB sample might play a crucial role in suppressing cell death mediated by ferroptosis affecting the tumor originasis and RB. Further studies might give better insight into understanding the contribution of GPX4 as potential biomarker in prognosis of retinoblastoma. Take-away home message is GPX4 is a central mediator of the ferroptotic pathway. I would like to acknowledge my co-authors, and I would also like to thank ICMA for providing the funding and all the patient and their parents. Thank you.